Cultural Competency Toolkit. Evolving practices to provide care to all patients. What is cultural competency? According to the Department of Health and Human Services, HHS, 2018, cultural competency is a concept that embraces diversity by constructing strategic resources and services in order to demonstrate an understanding for the principal demands of a target audience. HHS.gov has established the National Culturally and Linguistically Appropriate Services Standards with the intention of respecting quality care and services that ensure culturally diverse health beliefs and practices, preferred languages, health literacy, other communication demands. The national class promote governance, leadership and workforce, communication and language assistance, engagement, continuous improvement, and accountability. Lesson 1. Key terms associated with cultural competency: diversity, ethics, and health disparity. Diversity, the inclusion of different types of people, races, and cultures within a group or organization. Diversity advances healthcare. Diversity is imperative to a successful healthcare delivery system and to thriving community. Diversity within healthcare teams fosters superlative collaborations. Providing exceptional care requires exploring new ideas and breaking cultural barriers. Ethics, a set, theory, or system of moral values. How does cultural competence training steer ethical decision-making? Cultural competence training enhances clinicians' awareness of moral underpinnings in order to facilitate unbiased care, allows healthcare professionals to identify the importance of culture within society, teaches cultural differences, helps to limit possible negative outcomes of cultural differences. Health disparity. Particular groups of people experience high rates of specified diseases which causes more deaths and suffering for them, compared to others. Health disparities are categorized by race, ethnicity, immigrant status, disability, gender, sexual orientation, geography and income. According to the Agency of Healthcare Research and Quality, cultural competence is often ill-defined, misconceptualized, and operated inefficiently. Organizations commonly struggle to educate and employ practices that train providers to attain cultural competence. The scope of cultural competence is often limited to racial and ethnic differences, which in turn omits other marginalized groups. Healthcare disparities can be caused by patient stigmatization and discrimination and/or the inability to meet patient healthcare needs. Less considered disparate populations include persons with disabilities and persons identifying as lesbian, gay, bisexual, transgender, queer/questioning, and/or intersex LGBTQI. The Agency for Healthcare Research and Quality, AHRQ, 2014, asserts. Lesson 2. Bias within healthcare. Healthcare professionals demonstrate implicit biases towards patients through unconscious awareness that lead to a negative evaluation of a person on the basis of extraneous characteristics such as race or gender. Authors describe characteristics of implicit bias: stating stereotypes or conducting prejudices, negatively evaluating members of a group that are similar to one another, stipulating that an implied association represents a bias only when likely to afford a negative influence on an already disadvantaged group, stipulating that biases are not innately bad, but only to be avoided when they incline us away from the truth. Strategies to deliver impartial healthcare. Stereotype replacement, adjusting a response that is usually based upon a stereotype. Counter-stereotypic imaging, imagining someone opposite of the stereotype. Individuation, seeing someone for who they are and not for society portrays. Perspective taking, illustrating empathy. Increasing opportunities for contact with individuals from different groups, culturally diffusing one's network. Partnership building, viewing patients as equal stakeholders. Lesson 3. Cross-cultural communication. Cross-cultural care emphasizes the ability to communicate effectively while delivering quality healthcare to patients from diverse sociocultural backgrounds. Click here to see how cross-cultural communication is rendered within our organization. During the last Performance Improvement Commission meeting, providers discussed ways to advance adherence for their disabled and elderly patient populations. Michael Sidney, MD, for COG is able to facilitate cross-cultural communication by educating Ms. Reed on the spread of HIV within underserved African American communities. Valentina Velasquez not only operates as an on-call translator for the ER, but she serves as a member of the hospital's Patient Advocate Committee in order to promote ideologies that diversify organizational culture. Lesson 4. Measures to establish and maintain a culturally competent organization and environment. Conduct a cultural competency self-assessment. Obtain a cultural competency certificate. Improve communication and break down language barriers. Incorporating certified interpreters who understand the importance of safeguarding protected health information. Engage in cross-cultural interactions with patients by attending networking, seminars, and social diverse events. Oh, and don't forget to forecast future healthcare demographics. In a 2015 study, Cigna Healthcare foresees that by 2055, racial and ethnic minorities are expected to become the majority. Our vision is to allocate resources to develop advanced health in order to service patients of all demographics and in all geographical regions. Test your knowledge. Click the link below to access a 5-question assessment. Good luck. Connect with the Holistic Healthcare Department of Ethics and Inclusion. Open, Monday through Friday. Hours, 8 a.m. through 4 p.m. Phone, 410.123.4567. Fax, 410.123.4568.